Hi, I'm Dr. Thad Deal, and on today's video I want to talk to you about our neuropathy recovery program. But first, let's talk about what neuropathy is. If we look at the word and break it down, neuro simply means your nerve, pathy means your nerve is sick or dying. In order to figure out what's causing this, let's talk about what a nerve needs to be healthy. A nerve needs two things. It needs fuel and activation or stimulation. Fuel comes in the form of oxygen and glucose. So most people realize that diabetics can develop neuropathy, but you do not have to be a diabetic to have problems with your blood sugar. It's probably the #1 cause of developing a peripheral neuropathy, and oftentimes it precludes or precedes the actual diagnosis of diabetes. Your nerves are real sensitive to glucose levels, so we need to look at and help to optimize healthy blood sugar levels. The second component of fuel is oxygen. So we need to look for and specifically address anemias, because anemias affect the red blood cells' ability to carry oxygen to the cell to make fuel for energy. And that's also one of the reasons why in a lot of our patients we will utilize exercise with oxygen therapy. Again, oxygen is fuel for our brain and nervous system, and by doing this we can help our patients to heal faster. And then we want to use specific therapies to help stimulate the nerve to restore function. If you are not diabetic, most of the people fall into the category or are labeled as idiopathic neuropathy, which simply means we don't know what's causing your neuropathy, and usually that's because the investigation or further investigation necessary to do so hasn't been done, because honestly it doesn't affect the treatment. Medically, the treatment option is drugs, antidepressants, tranquilizers, and seizure medications that just help cover up the symptoms. They don't get to addressing the actual cause. So we're going to talk about some of those other things that can cause nerves to become sick or damaged. The first of which was glucose, which we addressed. Second most common, believe it or not, but oftentimes or very rarely looked for, are autoimmunity, secondary or driven by food sensitivities. Many patients can be making antibodies or mounting an immune response, so their immune system is actually attacking myelin, which is the sheath or the insulation that surrounds the nerve, and this can be triggered by certain foods that we eat. One of the most common is gluten, a protein found in wheat and other grains. Now, you do not have to be celiac to have a problem or sensitivity with gluten, and the testing is completely different. We utilize some of the most accurate and sensitive testing available through Cyrex Laboratories to help us best identify those individuals who are having reactivity or sensitivity to certain foods. We can also actually check now to find out whether or not you are making antibodies against your myelin, because if so, we are dealing with an autoimmune mechanism, and we really need to look at your immune system and how do we help support and modulate your immune system through diet and specific supplementation to decrease that inflammation. The third cause of neuropathy can be due to toxicities, to things like heavy metals. Chemotherapy is a cause sometimes of peripheral neuropathy. By a similar vein, deficiencies, certain B vitamins and other nutrients can lead one to develop a neuropathy. And last but not least are physical problems like a bulged or herniated disc in the spine, which we can address through chiropractic care, spinal decompression, and other therapies. But also, We don't want to forget the importance of the brain. Everything we experience, feel, ultimately depends on healthy brain function. Sensory information is processed in an area of the brain called your parietal lobe, and sometimes if the parietal lobe is not functioning as it should be, that message can become distorted. And just like when the radio station in our car is a little bit off, the station comes in fuzzy, that sensory information can get a little fuzzy and lead to numbness, tingling, burning, or weakness. So we want to do a good functional neurological evaluation to look at your spinal health, your brain, and your nervous system to help us identify if any of those areas aren't working exactly like they should be, and then we can help to strengthen those areas through specific therapies. We look at the brain like a muscle. They're actually a bunch of smaller muscles, and there are particular exercises that we can use to target those areas that have become weak to become stronger. But we also want to address all the metabolic factors that are affecting fuel delivery. One of the tools that we use very, very effectively is the Rebuilder, which is a neurostimulator that is actually used by Cancer Treatment Centers of America to help with chemotherapy-induced neuropathy. We use this tool very, very effectively with all of our neuropathy patients, but it's just one tool. We need to look at and support all the aspects, because what happens is a lot of time people go online and buy a Rebuilder, try it at home, and get minimal, if any, results because they didn't look at the metabolic factors, blood sugars, anemias, food sensitivities, and all those other things we need to look at through our specialized comprehensive testing that we do, and address them through changing their diet, changing their lifestyle, eating for optimal brain and nervous system health. And that's really what makes our program so unique and so successful, by looking at and addressing the actual causes of why your nerves are becoming sick or damaged. So if you're interested in finding out whether or not this could be the answer for your peripheral neuropathy nightmare, I invite you to please call our office to schedule an initial discovery visit and a neuropathy qualification evaluation. Our office phone number is 814-238-0232. After doing this, we will know whether or not you are a good candidate for our neuropathy recovery program. So again, if you're interested in finding out how and if we can help, please call our office at 814-238-0232.